I would say out of all the treatments that we have for pain, cortisone has the highest response rate. I would say about 70% of patients respond to cortisone injections, assuming that you selected them well.
Welcome to Chronic Pain Chronicles with Dr. Karmy. In today's episode, we'll be discussing cortisone injections, what they are, how they work, and why they're a useful option for treating joint pain. I'm Ravina, your host, here to guide you through today's discussion. This topic is important for pain management because while cortisone can offer significant relief, understanding its limitations and risks is crucial for making informed treatment decisions.
Hi, this is Dr. Karmy, and today I wanted to discuss cortisone injections. Perhaps it's a little bit redundant because most people have heard of cortisone shots. However, I feel like there are some misconceptions about them that I wanted to clarify. First of all, what are cortisone injections? Cortisone is a hormone. It is a glucocorticoid, but it's very different from sex hormones like estrogen or testosterone. Some people confuse the two. It has no impact on size of muscles or whether or not someone has breasts or a beard. Cortisone is a hormone that's very involved in stress response, in metabolism. But the reason we use it in chronic pain is because it also reduces inflammation. It is one of the most powerful anti-inflammatory injections that we have. Generally speaking, some people will take cortisone in tablet form called prednisone, which if taken for a few weeks, usually is not too problematic, but if taken for months and years, can cause all sorts of side effects, including bone loss, diabetes, skin atrophy, weight gain, you name it. When cortisone is administered in an injection form, you can get all these same side effects. However, chances of a person getting them are very, very low. Just because cortisone in injection form typically hangs around your body for just a few weeks, and the majority of the cortisone stays in the joint that you inject it into, and relatively small amount goes into the circulation. So what is cortisone used for? Typically, it is used for treating joint pain. It is used for treatment of tendons, such as tennis elbow, for example, or plantar fasciitis. It is also used to treat inflammation around the nerves. So it is often administered when one treats disc herniation with an epidural injection. What it does not treat is muscle pain. It is not particularly effective for most types of headaches. So what are the pros and cons of this approach? The pros of cortisone injections is relatively rapid onset of action. It can start helping within 2 days to 2 weeks after the treatment. I would say out of all the treatments that we have for pain, cortisone has the highest response rate. I would say about 70% of patients respond to cortisone injections, assuming that you selected them well. It is also an OHIP-covered treatment, so patients don't have to worry about coverage. So When it comes to cons, it can damage bone, cartilage, occasionally can even cause stroke or the spinal cord. People are afraid of it. In terms of strokes, they typically happen as a result of cervical or perhaps lumbar epidural injections. To put it in perspective, chances for some of those more serious complications are extremely low, but nevertheless, it's a remote possibility. Chances of bone or cartilage damage are more common. I have seen 2 cases of osteonecrosis or bone damage after cortisone injections. I think the risk probably increases for patients who don't just do cortisone once or twice, but do it every 3 months on regular basis. Other complications I should mention is that there is some evidence that if cortisone injection into the knee or hip is done too close to hip or knee replacement surgery, there is an increased risk of post-procedure infection, perhaps because cortisone reduces inflammation and weakens the immune response. Again, for that same reason, there is some discussion whether cortisone should be done around the same time as immunizations. And also, cortisone can destroy pigment of the skin in the area injected. So if people have dark skin in particular, they may end up with a small white patch at the site of cortisone injection, and that white patch will often stay permanently. There's no specific issues with that, but it is a cosmetic issue for some patients. Cortisone can also cause muscle atrophy, which is why it is typically not used to treat muscle pain. The atrophy typically again happens in the area of injection. There is some sort of impression in some circles that you're only allowed to have 2 cortisone injections in your lifetime. There's no evidence to suggest that that is accurate. However, there is some suggestion that for women, especially as they approach menopause, perhaps the dose of cortisone per year should be limited to no more than 320 milligrams, or for treatments of 80 milligrams per year. There's also some discussion as to whether or not one needs guidance with ultrasound or X-ray in order to perform successful cortisone injections. The idea being that if you are not in exactly the right place, it may somehow make the injection more dangerous or ineffective. In my opinion, the answer is emphatic. I think if you have a physician who is well versed in landmark-based injections of cortisone, they will do well with landmark-based injections. If you have a physician who is well versed with ultrasound or X-ray guided injections of cortisone, they will do well with ultrasound guided injections. So I think what's most important is the level of expertise and comfort of your physician, then the approach that they use. Cortisone is one of those medications that does spread. So if the needle is not exactly on the target, generally speaking, it'll spread and the effect will still be there. A lot of surface joints, one can very easily feel the edges of the bones, in which case often landmark-based procedure is easier to perform than guided injections. Guided injections also provide a potential additional source of contamination, the ultrasound probe, which could potentially lead to infection, one of the most feared complications of any type of injection. Also, in order to do ultrasound injections and actually be able to see the needle tip and where it's going, you often have to use a thick needle, which will lead to additional post-injection pain and tissue trauma. That doesn't mean there's no place for guided injections. For instance, College of Physicians and Surgeons of Ontario is now requiring that all epidural injections are done under X-ray or ultrasound guidance. So we have no choice if we want to protect our license. Also, some of the deeper joints that one cannot feel the edges of the bone easily, like for instance, shoulder joint or hip joint, I feel that ultrasound will provide greater level of accuracy and consistency. Brachial plexus blocks, sciatic blocks, again, we often don't have very good landmarks. These particular nerves do not run next to a bone. However, for vast majority of locations and targets, be it nerves or joints, it is questionable whether ultrasound really leads to better results. So what are my final thoughts on cortisone injections? I think that cortisone is an incredibly useful approach to pain management. It is often my go-to treatment in people who come in with excruciatingly severe flare-up of pain in the back or big toe due to gout or any other joint of the body, provided that the pain wasn't caused by an injury. Cortisone does slow down healing after an injury. If possible, one tries to avoid injecting cortisone frequently, and if it helps for 6 months or a year or 2 years, even better. So it has its uses, but it is not a silver bullet for chronic pain.
Thank you for listening to Chronic Pain Chronicles with Dr. Karmy, where we explore chronic pain from a physician's point of view. In our upcoming episodes, we'll continue to delve into some of the most effective and widely used approaches to managing chronic pain. We'll also investigate the causes of chronic pain and where the field is heading in the future. Furthermore, Dr. Karmy will interview seasoned professionals and leading researchers in the field, sharing their insights and expertise in our discussions. Disclaimer: when it comes to your health, always consult with your own physician or healthcare provider for personalized advice and guidance. The information provided in this podcast is for educational and informational purposes only and should not be considered medical advice or a substitute for professional medical care.